this is Liz from East West Physiotherapy. Thank you for tuning in to our channel. If you have been enjoying our videos, please click the like and subscribe button, as this really helps us determine what types of videos you enjoy so we can continue making more videos on topics that help you. Today, we'll be going through some exercises that will help relieve your sciatic pain. Pain going down the leg can originate from the low back or the gluteal region. The sciatic nerve starts in your low back from the L4 to S3 region and joins together as one big bundle of nerve to travel down the bum, back of thigh, and down the back and outside of the leg and foot. Sciatica is the irritation or compression of this nerve, and it can occur along the entire length of the nerve, but it most commonly occurs in the low back and hip area. The goal of these exercises is to release any pressure and irritation that is placed on the nerve, causing numbness, aching, and tingling down the leg. Go through this routine step by step, as this starts with the most gentle exercises to prevent any aggravation of the nerve. The first 3 exercises are generally very comfortable for sciatica, regardless whether the issue is starting from your low back or the hip. Supine double knee to chest. Lay on your back and bring both knees toward your chest. Hug them tightly and feel a gentle stretch in your low back and bum area. This is a relieving position for acute sciatic symptoms. Hold for about 30 seconds and repeat it another time if it feels good. From that double knee to chest position, gently release the unaffected leg and extend it out on the floor or bed. Feel a gentle stretch in the hip and low back. Hold for 30 seconds. From the single knee to chest position, angle the knee towards the opposite shoulder. This should be done on the affected side. Feel a stronger stretch in the bum area. Hold again for 30 seconds. Now place both feet on the floor and let both knees fall down to one side. This should be a gentle stretch at the hips and low back area. You can experiment with how high or low you want the knees to get a better stretch. Next, we get into the hip area more. If you find really good relief with these next 2 exercises, it is a sign that your piriformis muscle in the hip is compressing your nerve. This is also known as piriformis syndrome. Bend both knees and bring one ankle up to cross and rest on the opposite knee. Push the knee that is crossed down. If you feel a good stretch in the hip here, stop at this position. If you don't feel much, then weave one hand through the legs and bring the other hand up behind your knee to pull the legs closer to your chest. You should feel a stronger stretch in the hip area. Hold this anywhere between 15 to 30 seconds. If this feels good, repeat it 2 times. Turn to lay on your belly. Bend the hip and knee of the leg of the painful side out beside you and rest in this position. If it is uncomfortable, you can place a pillow under the hip or knee to make this position more comfortable. This position is putting your piriformis muscle on slack, so if this position brings a lot of relief, it is a good sign of piriformis syndrome. This last progression of exercises will be effective if your sciatic pain is originating from your low back. Don't skip any steps. Start from the most gentle position first. This is known as the Mackenzie protocol. Lay on your belly with a pillow. Hold for 3 to 5 minutes. If this feels okay to progress and there is no worsening of symptoms, take out the pillow and lay straight onto your belly. Hold this position for 3 to 5 minutes. If it feels okay, then prop up onto your elbows. With these exercises, you are looking for symptoms to decrease in the legs. You want the symptoms to start to go away from the lower leg, thigh, and hips. We are looking for the pain to settle more in the low back and decrease in the legs. If you find that these exercises persistently increase symptoms in the leg, then these are not the right exercises for you and you should stop. If it feels okay to progress, go up onto your hands. Hold this position for 10 to 20 seconds, then repeat 10 times. Remember, you're looking for the symptoms to move up towards the low back. I hope you found some useful information here and you're able to find a pain relieving position for your sciatica. Leave a comment or message down below and let us know how this worked for you. Till next time.